Hey everybody, welcome back to Firm and Final, a quick 5 minutes on the stop loss industry. So for this week, I want to talk about a conference that we held last week. So BCS Financial, we're a company that's wholly owned by all the Blue Cross Blue Shield plans. And every year we run a large claims conference for our owners. Last week, we had 14 Blue Cross plans participate. And we get these plans together to talk about industry trends that are happening in the stop loss, reinsurance, gene therapy space. And not surprisingly, gene therapy was the number one topic we were speaking about during the conference. And at the conference, we had Doug Ingram, who is the CEO of Sera Therapeutics. Sarepta is the maker of Elevidys. That is the therapy I spoke about last week. It's the treatment for Duchenne muscular dystrophy. This is a therapy that costs $3.2 million per treatment. The prevalence population for this therapy is pretty high. The therapy was just fully FDA approved in June of this year. Also at our conference had Ashley Hume, who's the president of Emerging Therapy Solutions. And ETS is a company that's helping stop loss carriers and reinsurers understand the pipeline, price for these therapies, but then also have the right type of cost containment around gene therapy. So it was really interesting having both of these two speakers at our conference. On one side, you had Doug talking about this really horrible condition of Duchenne muscular dystrophy. Starting at childhood, it impacts boys. And by the time these boys are in their late teens to maybe their early 20s, many of them will not survive. And so Sarepta has been working on this therapy for several years now. And like I said, it was FDA approved here in June of this year. However, when Sarepta went through the clinical trials for this therapy, they did not meet the primary endpoints of the clinical trial. It did, however, meet several secondary endpoints of the clinical trial, and the FDA said because of that, they're going to go ahead and approve the therapy. Now, because of it not meeting the primary endpoints, many health plans are excluding Elevidys from coverage. And that is going to create a ton of noise in the stop loss and reinsurance space because employers will have to decide how they decide to cover that therapy, whether they consider it to be experimental or they consider it to be the right treatment for a member who has that condition. We know that stop loss carriers have their own exclusions and terms and conditions. And so where that doesn't align with how employers think about it, that could create a gap in coverage. Now, at the same time, stop loss carriers, many of them buy reinsurance. And so where a reinsurer thinks about Elevidys as an experimental treatment, but the stop loss carrier considers it a covered treatment, that also creates a gap for the stop loss carrier. And so these were the issues that we were talking about. From the Sarepta perspective, obviously they want health plans to cover this treatment. They wanted to explain to the health plans that were in the room why it was important to cover this treatment and why perhaps it didn't meet the primary endpoints of the clinical trial, but how the secondary endpoints were super material, and which is why the FDA gave them approval. But when we had Ashley from ETS present, she really spoke about the need to think about medical policy, and she's right on about that. Thinking about medical policy, how is the employer going to think about covering the therapy, and how does that translate to the employer's stop loss coverage? And also from the ETS perspective, keep in mind that the gene therapy has an ingredient cost. That's the $3.2 million. But there's also situations where there's pre and post treatment expenses. And then you also have the facilities that are acquiring the therapy and then perhaps adding on an additional expense before the entire invoice is determined. And that's really the role that ETS is playing. They're trying to make sure that the therapy is being procured by a facility that has a center of excellence deal with ETS, and that creates for a bundled pricing approach that could mean a lower expense. So we spent a lot of time talking about this issue because it has stop loss implications. It's got reinsurance implications. It's really a very sticky situation as we go into the renewal season this year. I encourage you all to get very familiar with this therapy. Again, Elevidys by Sera Therapeutics. In the next coming weeks, we probably will spend a lot of time talking about gene therapy, but we'll close it up there for today. Thanks for listening.